going to just go ahead and begin. I'm Jay Kempton. I'm the co-founder of the Free Market Medical Association, along with my good friend, Dr. Keith Smith. As Chris mentioned, about half of the attendees are new. So we're gonna do a little reflecting and a little summarizing, but I think it's going to be amazing. First off, we want to welcome you, as Chris said, to the 2024 10th year anniversary of the Free Market Medical Association Conference. Our conference is sold out this year. Actually, second year in a row. Last year, we sold out our Kansas City venue with an attendance of over 300. This year, this beautiful venue here in Oklahoma City has a capacity of 500. It's pretty cool. This is going to be a very special celebration, not only the 10-year, but Lynn Ann and the entire Connections team, they do a really amazing job to help us put on a first-class event. We're also so glad that you all are here and have chosen to share your experiences with others in this vitally important movement. Our theme, as Chris said, is Back to the Future this year, and we have come a long way in these 10 years. Normally, we are a very forward-looking association. Thinking about and helping shape the future of healthcare is sort of our thing at the FMMA. However, this year we're going to do a little reflecting, maybe even take a short victory lap or two. But before we do that, I'd like to briefly discuss the FMMA and what makes us tick and how this association is different. From the beginning, the FMMA was designed to be a different kind of association, one designed to share and communicate best practices in healthcare, with a focus on integrating and executing free market economic principles in this space. These best practices emerged from the effect of one courageous seller, Surgery Center of Oklahoma, here in Oklahoma City, who was frustrated and their existence threatened by the collusion of big insurance and big healthcare. And they decided to push back. In 2009, Surgery Center of Oklahoma wanted to counter this cartel-like collusion and decided to do the hard work to get a precise understanding of their costs within the center and what their partner surgeons would be willing to do their surgical cases for, with a reasonable profit margin built in, to come up with a comprehensive bundled price for their services, or as we like to say here in Oklahoma, the all-in, all-done price. Once this was completed, they did like any other business would, outside of healthcare, of course. They posted their bundled prices on their website and hoped buyers would beat a path to their door. They knew that they had talented surgeons, a top-flight staff, great surgical outcomes, and they also knew that they were able to deliver all of this at a price that was roughly an eighth of what the other competitors across town were offering these surgeries for. However, that's not what happened. The buyers did not beat a path to their door. Better and cheaper did not result in more customers. In fact, the response to posting these pre-discounted, easy-to-buy and compare bundles on their website, most insurance companies wanted nothing to do with them and dropped them from their networks. Also, most of the self-funded employers whose plans were administered by the insurance carriers also didn't want anything to do with this now out-of-network surgery center. Yes, the cartel had put its defenses up and had Surgery Center of Oklahoma dead in its sights. A pre-discounted, all-inclusive surgical bundle was of little use to the discount brokers that were firmly in control of the Oklahoma City insurance market. Times were tough, and the future was in question for Surgery Center of Oklahoma. But it wasn't until an independent, family-owned third-party administrator, the Kempton Group, was introduced to Keith Smith in 2011 by a mutual friend and neighbor of Dr. Smith's, who also happened to be a customer of mine, that something special happened. You see, this one third-party administrator was also just as disgusted by the healthcare status quo and all of the games that were being perpetrated on its employer customers and the financial damage that was being inflicted on their employees and families. Kempton Group administrators operated and managed the self-funded health plans for these local Oklahoma employers and had always wondered why there wasn't a market clearing price for healthcare like in every other industry. These employers and their health plans they're very interested in getting the best possible healthcare for their employees and their families, but they also wanted to get it for the best possible price. Our clients jumped at the opportunity to buy from Surgery Center of Oklahoma at their cash and carry prices, and they did, big time. This all worked because of some innovative and somewhat unorthodox, at the time, plan design that we developed. Deductibles and coinsurance would be waived by the employer's health plans if the patients chose to have their procedures done at Surgery Center of Oklahoma at their bundled price. This did two very significant things. One, it created incredible steerage for these patients to choose the surgery center. Two, it ensured that the price that the Surgery Center of Oklahoma was offering was the price that was paid by the employer. No patient responsibility to chase. We finally had a fully transparent price for a logical unit of care. Keith and I quickly discovered that a free market-minded employer could be the ultimate cash buyer. This was in 2012. What happened over the next few years was nothing less than an embodiment of the free market principles that all other industries must contend with and excel at, or they would suffer the judgment of the market, which can be quite harsh. It wasn't too long before Surgery Center of Oklahoma had several competitors working hard to emulate what Keith and his team had done with their bundled pricing. Some of those competitors are right here in this room with us today. It also wasn't too long before I had my competitors clamoring to buy from Surgery Center of Oklahoma, as well as these other newly minted free market providers at their best bundled cash prices. Many of my competitors are right here in this room with us today as well. This was all happening because of our respective competitors. Our respective competitors were reacting to Surgery Center of Oklahoma and the Kempton Group administrators doing business together in a transparent, bundled, cash and carry way. They also knew that if they didn't react, the market was going to judge them, possibly harshly. It was very different from the opaqueness and tightly controlled constructs developed and maintained by the cartels. This is really key. High-value bundled cash pricing and its naturally deflationary results had come to the Oklahoma City market, naturally, through open, bare-fisted competition. We knew that we were witnessing something special in our industry, an industry that we had all been told that price transparency just wouldn't work in. No, patients and employer buyers were just not capable of discerning value on their own in healthcare. Healthcare was different. It was too complicated and just can't be expected to be bought and sold like an automobile or a pair of shoes. However, we had a front row seat to the repudiation of that myth. It was happening without any legislation being passed. This wasn't some governmental transparency mandate. No, this was the free market at work. By 2013, we had decided that we had to share with the rest of the country what was happening here in Oklahoma City. We felt we needed to share why we felt it was happening and share what we thought were the right ingredients that needed to come together to have this happen in other markets. This was when the Free Market Medical Association was born. We didn't want this association to be a profit center for anyone. We both had day jobs that kept us plenty busy, but it had to be a disruptive and influential tool to drive positive changes in the healthcare industry. Ironically, we configured the FMMA as a for-profit association, but we have always run it in such a way where we pour back into the association any surplus derived from its operation to make this association more effective, expand its influence, and to bring more value to you, our membership. We also didn't want to have to hold back any of our rhetoric if we needed to call someone out, if it was either in industry or in government. Keith and I have always said, from a business side of the FMMA, if we can be effective in driving positive free market principles back into healthcare and do it in a way that prevents the Kempton or the Smith family from having to write a check at the end of the year, that would be our definition of success. However, probably one of the most unique aspects of the FMMA and its membership is that we limit membership to only organizations and individuals that pledge to do things differently, to operate in a way that shifts the goal of healthcare delivery and operations from being focused on driving profits to be that of driving value. The best possible quality at the best possible price. This is a novel idea in healthcare, one that rarely gets practiced by the cartel and those who have hitched their fortunes to ever-increasing healthcare costs. The FMMA pillars are a gateway in which all members that are sellers or facilitators must pass through. Your association is unique in that it denies anyone membership that we discover through our vetting process of having a business model in which they receive monetary gain when healthcare costs go up or remain hidden. There's an old German proverb that we like to quote here at the FMMA: "Whose bread I eat, his song I sing." Misaligned incentives are the root cause of much of what is broken in healthcare. The FMMA is unwavering in upholding these pillars. If you win when healthcare costs go up, or when healthcare costs are hidden behind a locked door that you charge access to enter, you will not be a member of the FMMA. There are many of our peers in healthcare who say that they are the good guys. They say that they're working to drive value. But they also know deep down that if they're not effective in their publicly stated mission, they will still receive a financial windfall, as healthcare inflation is a very reliable sugar daddy. Their profitability will likely be assured as the cartel continues its march upward in cost. It's only those who have drawn a line and uncoupled their livelihood from the problem who gain membership. So look around at who is a member and who is simply an attendee. For the non-member attendees in the audience, we welcome you and value your attendance here at the FMMA conference. As Keith and I say, you can't save souls if you don't get them in the pews. Please listen, enjoy, and learn from the members of the FMMA, because at some point, everyone in this room that has worked in this industry with misaligned incentivization at some point. But when you step up, draw the line, burn your ships, and dedicate yourself and your business to working to drive value, transparency, and true competition, that is when you become part of the solution. It's worth it. Heck, just sleeping better at night makes it worth it. To date, we have over 400 FMMA members, and they're all sleeping better. So this was our mission. Share what happened here in Oklahoma City with as many others as possible, with an eye towards inspiring the adoption of free market-friendly business practices to each of the stakeholders in healthcare. And it breaks down like this: buyers, sellers, and facilitators. Buyers are easy. We're all buyers of healthcare goods and services. Every man, woman, and child in America is a buyer. Some buyers are aggregated together into groups through their employer or through a health share. When an employer sponsors a self-insured health plan, then that health plan also becomes a buyer. If the employer simply buys health insurance from an insurance company instead, that employer is not a buyer of healthcare. They are a buyer of insurance. Their insurance company is the buyer of the healthcare. Ironically, insurance companies are the only buyer that actually benefit directly when they pay more for what they're buying. Sellers are the providers of healthcare. They sell and provide the actual care. Facilitators. This is where a lot of the misaligned incentives live. Some examples of facilitators are third-party administrators, pharmacy benefit managers, PPO networks, navigation companies, RBP repricers, brokers and consultants, and others. I am a facilitator at the Kempton Group. However, as an FMMA member, my role is to reduce the friction of doing business between the buyer and the seller. Notice, I am not a buyer or a seller. I know exactly who I work for. I work for the buyer. Employers and their employees and their families. There are some conflicted facilitators in this industry who simultaneously work for both the buyer and the seller. In reality, they really work for themselves. The other two are simply pitted against each other to enrich the facilitator. In other industries, there are laws against these kinds of conflicts. However, not in healthcare. These conflicted entities are not members of the FMMA. Now that we knew who we wanted to reach, would anybody actually listen? In 2014, we rented a small ballroom a mile or so away from where we're sitting at the Skirvin Hotel. It was the first conference of our new association. We had no keynote speakers. Well, I guess probably Adam Russo considers himself as our keynote. But we had no event manager. We had no dinners, no cocktail parties. In fact, all we could think of is that we hoped that enough people would show up and pay so we didn't have to write a big check to cover the room rental. The room's capacity was 100 people. We had 110 attendees, with one of them being the Oklahoma City Fire Marshal, because we were over the room's capacity. The first conference was a smashing success. We were absolutely blown away, thrilled beyond our wildest dreams. We all go to a lot of conferences, but the feedback that we got after our first conference was unique. People were stunned that there were others that felt the way that they felt about healthcare, but had never openly discussed it. The networking was clearly one of the reasons that the first FMMA conference was such a resounding hit. On one of the breaks between speakers, Keith and I just watched the attendees interacting. It was frenetic. It just didn't stop. It was like the attendees were all best friends that hadn't seen each other in decades. We just couldn't believe it that first year. And we discovered that when you get buyers and sellers in the same room sharing each other's stories, challenges, and ideas to improve, it was very powerful. It was also very fun to recognize that the cartel had always counted on these two parties never getting together and comparing notes. At this point, the genie, however, was out of the bottle. Since that first conference, we've been blessed with wonderful turnout. Since the mission has always been about bringing free market principles to healthcare, we have had a very robust and impressive lineup of keynote speakers, many coming from a strong background in Austrian economics and the study and promotion of liberty. Some of our keynotes have been Jeff Deist, former president of the Mises Institute, Yuri Maltsev, senior fellow from the Mises Institute and also an economic historian from the Soviet Union. Unfortunately, we lost Yuri a few years ago. Dr. Ron Paul, Dr. Marty McCary, who's actually making an encore appearance this year at our conference. Steve Forbes, Lisa Kennedy, aka Kennedy, from the Fox Business Network, and Peter Klein, a professor of entrepreneurship at Baylor University. Most of our keynote speakers have donated their appearances, waiving their normal speaking fees. We believe that is another testament of the shared passion that we all have for what we're doing here at the FMMA. As the movement progressed and we talked with others around the country, we discovered that each market had its own unique challenges and opportunities. Not every market resembled Oklahoma City. So from that reality, the concept of the FMMA local chapters were born. These chapters are approved and sanctioned by the FMMA, yet are autonomous in operation, reflecting their own unique approaches to bring the FMMA principles to their markets. These local chapters are led by fearless, innovative, and creative individuals who share the FMMA vision and willingly give their precious time. Many have become quite successful and influential in their respective markets. We currently have 32 active local chapters around the country in 24 states. Today, 27 local chapter leaders representing 23 chapters are here at the conference. If we could turn some lights on, Marshall, that'd be great. I'd love to have the local chapter leaders stand to be recognized. Thank you all. When I reflect on these last 10 years, I'm struck by the changes in my everyday work life, as I'm sure many of you can relate. The things we think about, the things that we worry about, hope for, strive towards, the problems we work every day to solve, the successes we enjoy, they are all different than 10 years ago, substantially more positive, more righteous, but not always easier, but all markedly different and better. What I'm trying to say here is that in the last 10 years, we have all been witness to dramatic change in healthcare. The interesting thing about historic change, though, is that rarely do people directly involved in that change recognize that it's occurring right in front of them. Today, there are hundreds of facilities around the country offering some kind of bundled direct-to-employer pricing. With so many sellers desperately looking for value-minded buyers, we have a new industry that has formed as a result, and that is the marketplace/navigation industry, whose job is to connect buyers and sellers. Free market, full pass-through pharmacy benefit managers were also not a thing 10 years ago. Now, they all try and out-transparency each other. That, folks, is progress. However, yeah, you can clap for that. However, one of the most disruptive aspects of the free market healthcare space has been the emergence of the independent direct primary care practice. DPC has grown tremendously in the last 10 years to over 2,200 independent practices across 48 states, according to dpcfrontier.com. And as DPC physicians reassert their autonomy over the care of their patients, we're seeing a growing hunger and demand for transparency and value all along the care continuum. We have also seen a lot of innovation in the areas of how DPCs effectively work with employers and their health plans. However, as with any other disruptive innovation, there is always a lag of when regulations catch up with that innovation. I would simply caution us all to not become the poster child for some regulator of what not to do in this space. There are some wonderful yet delightfully disruptive lawyers who are card-carrying members of the FMMA here at this conference who would love to assist you in changing the world legally. The employees at the Kempton Group, we've used direct primary care for over 8 years, and I know that we will never go back to the old system of having a physician who literally works for someone else besides their patient. Now, some of you also may have noticed several attendees with student on their badges and in the Whova app. Reaching medical students and educating the next generation of healthcare sellers and practitioners has always been a goal ever since our very first conference when we partnered with the Benjamin Rush Institute. Today, with a lot of help from Jack and Dr. Kathleen Brown, Jocelyn Lombard, and the Benjamin Rush Institute, and the following sponsors: Do No Harm, Christian Healthcare Ministries, Dr. M. Lane Payton, the DPC Alliance, Dr. Perry Santos, Dr. Grace Torres Hodges, Jerry Huber, J.R. and Tracy Martin, Dan Barnett, Brian Perry, and the Validation Institute. Because of them, we have over 80 medical students in attendance from 10 different med schools around the United States. Today's med students are hungry for information about their options available to them after graduation and residency, and many of them are starving for it. The cartel has a vested interest in capturing and keeping these new physicians under employment contracts. And that may be the right decision for some, but we are strong believers that the future of medicine should be focused on the individual patient, not a population, and that these physicians should have the basic business acumen to evaluate all available business options and choose the right one for themselves. Independent physicians working solely on behalf of their own patients have prevented all kinds of tragic consequences and ill-conceived governmental and corporate schemes throughout history. I cannot overemphasize how brave and courageous these 80 students are for even being here. A medical student even hearing about an alternative that isn't becoming a hospital system employee after residency is aggressively discouraged by the status quo. And that's about as light and delicate as I can put it. You will be hearing more about the plight of the inquisitive and independent thinking medical student later in the conference by Dr. Stanley Goldfarb with the Do No Harm organization. If the students are comfortable standing and being recognized, please do so at this time. We would love to recognize and welcome you to the Free Market Medical Association. As I mentioned earlier in my remarks, we view the FMMA as a tool, a vehicle to share ideas and best practices in free market healthcare and foster the kind of DIY healthcare reform that we all seek. This is not an easy task, but we are all up to it. As we have said many times before, the status quo, the cartel, for the status quo, healthcare isn't broken. It's working just as intended. We respectfully disagree. Welcome to the 10th anniversary of the Free Market Medical Association.